Most people don't find out their kidneys are failing until they've already lost more than half their kidney function. More than half. Gone. And by that point, there's no reversing it, only managing it for the rest of your life. And the scariest part? The warning signs were there the whole time. Months, sometimes years, before the diagnosis. They just didn't know what to look for. Or worse, they saw the signs and told themselves it was nothing. That's exactly what we're fixing today. In the next few minutes, I'm going to walk you through exactly what your kidneys are trying to tell you. The real signals, the ones that are easy to brush off, and more importantly, what you need to do before it's too late. Stay with me, because one of these signs might already be happening to you right now. Let's talk about what your kidneys actually do, because most people have no idea how hard these two organs are working every single second of every single day. Every 24 hours, your kidneys filter roughly 200 liters of blood. Think about that. 200 liters. They're pulling out toxins, regulating your fluid balance, managing your blood pressure, keeping your bones strong, and even helping your body produce red blood cells. They're doing all of that quietly, constantly, without you ever having to think about it. And that's exactly the problem. When kidneys start to fail, they don't send you a dramatic signal. There's no sharp pain, no alarm going off, no obvious moment where you think something is seriously wrong. Instead, they send quiet clues, subtle, easy-to-miss messages that most people write off as stress or aging or just not drinking enough water. By the time the symptoms become impossible to ignore, serious damage has already been done. So let's decode those clues right now, before that happens to you. The first sign is something most people see, think nothing of, and move on with their day. Foamy urine. Here's what's actually happening. When your kidneys are healthy, they act as a filter, keeping protein inside your bloodstream where it belongs. But when the kidneys are damaged, that barrier breaks down. Protein starts leaking through, and it ends up in your urine. And that protein is exactly what creates the foam. Now, everyone gets a little fizz in the toilet from time to time. That's normal. What you're looking for is foam that lingers. Bubbles that don't go away after a few seconds. A frothy appearance that keeps showing up day after day. If that sounds familiar, don't dismiss it as dehydration and forget about it. That foam could be one of the earliest visible signs of kidney damage you'll ever see. Take it seriously. The second sign is more visible, and it tends to get worse as the day goes on. When your kidneys can no longer remove excess fluid from your body efficiently, that fluid has to go somewhere. And it usually settles in the lowest points, your ankles, your feet, sometimes your hands. You might notice your socks leaving deep, pronounced impressions in your skin when you take them off at night. Your shoes might feel perfectly fine in the morning, but uncomfortably tight by the afternoon. Your rings might be harder to remove than they used to be. This isn't just ordinary water retention from sitting too long or eating something salty. This is your body accumulating fluid it genuinely cannot process properly. The kidneys are supposed to be the ones managing that balance. And if they're struggling, the fluid builds up. Persistent, unexplained swelling in your lower extremities is never something to normalize. If it keeps coming back, it needs to be investigated. I need you to pause on this for a second, because this number is genuinely alarming. Chronic kidney disease affects 1 in 7 American adults. That's 37 million people walking around with compromised kidney function, and a full 90% of them have absolutely no idea. Not a clue. And the reason for that is exactly what makes this disease so dangerous in its early stages. It's nearly silent. Early kidney disease produces almost no noticeable symptoms. You can feel completely fine, live your normal life, and have kidneys that are already significantly damaged. By the time something feels wrong enough to send you to a doctor, you've often already lost a substantial amount of kidney function that is not coming back. That is why catching these signs early is not optional. It could literally be the difference between reversing course and spending years on dialysis. If you are exhausted all the time, genuinely, deeply tired, and sleep doesn't seem to fix it, your kidneys might be involved in ways you'd never expect. When kidneys start to fail, waste products that should be filtered out of your blood begin to accumulate. One of the primary culprits is something called uremic toxin. And uremic toxin doesn't just sit harmlessly in your bloodstream. It actively affects your brain function and your muscle performance. The result is a specific kind of exhaustion. Persistent fatigue that doesn't respond to rest. A mental fog that makes it hard to concentrate, hard to remember things, hard to feel sharp. A lot of people spend months assuming it's burnout, stress, or depression. They drink more coffee. They try to sleep more. Nothing helps because the real problem is that their blood is slowly accumulating waste that their kidneys can no longer clear out. If your fatigue is constant, unexplained, and unresponsive to rest, this is not something to keep pushing through. It's something to investigate. Your bathroom habits are one of the most direct windows into kidney health, and most people never pay attention to them. Kidney disease commonly changes both how much and how often you urinate. You might start waking up 2, 3, even 4 times during the night to use the bathroom when you never used to. You might notice your urine is darker or more concentrated than usual. Or the opposite, you might be urinating significantly less than you typically do, even when you're drinking the same amount of fluid. Any of these shifts, if they're persistent and unexplained, are worth taking note of. Don't normalize them. Don't tell yourself it's just something you ate or that you're getting older. A consistent, unexplained change in urination patterns is your body flagging something that deserves a closer look. If any of these signs are sounding a little too familiar right now, stay with me, because what comes next is the most important part of this whole video. I'm going to tell you exactly what to do. The 5th sign is one that doctors are trained to catch, but one that most patients never connect to their kidneys on their own. Uncontrolled high blood pressure. Here's the cycle that destroys kidneys silently over years. Damaged kidneys lose their ability to regulate blood pressure properly. Blood pressure climbs. Elevated blood pressure then puts more strain on the kidneys, causing further damage, which pushes blood pressure even higher. Around and around it goes. And it is one of the most common pathways to full kidney failure in adults over 40. If you're already on blood pressure medication and it's not controlling your numbers the way it used to, or if your doctor keeps having to increase your dose, that is a conversation worth having about your kidneys specifically. Ask directly. Don't assume it's just a medication issue. So here's what you actually do with all of this information. The next time you see your doctor, or the next time you call to make an appointment, ask for 2 specific tests. First, an eGFR, which stand for estimated glomerular filtration rate. It's a blood test that tells you exactly how efficiently your kidneys are filtering waste. Second, a urine albumin test, which checks whether protein is leaking into your urine. Together, those 2 tests give you a complete, accurate picture of your kidney health. They are routine. They are simple. They are covered by most insurance plans. And they take minutes to order. That's it. 2 tests. That's your action step today. Write it down if you have to. Catching this early changes everything. Early-stage kidney disease can often be slowed or even stabilized with the right interventions. Late-stage kidney disease cannot. The window matters, and now you know what to look for. If this video opened your eyes, hit subscribe, because next week we're breaking down the silent signs of liver damage that most people spend years mistaking for everyday fatigue. It's just as eye-opening as this one, and you genuinely don't want to miss it. I'll see you there.